Hello guys, I'm Dr. Arshad Nadeem Awan with my YouTube channel. Hope you are okay, you are enjoying your life, you are practicing ultrasound and you're watching my videos. Today my topic of discussion is liver cirrhosis. WHO defines cirrhosis as a diffuse fibrosis of the liver and a conversion of liver architecture into abnormal nodules. Three pathological processes combines to form the cirrhotic process. The one is cell death, the second is fibrosis. Fibrosis means when normal cell convert into scarring or scar tissues, and the third process is regeneration, development of nodules. There are two types of cirrhosis. The one is called as a micronodular cirrhosis, when the nodules appear less than 1 centimeter, or it's ranging from 0.1 to 1 centimeter, or macronodular cirrhosis when nodules appears up to 5 centimeter in size. How it will appear on the ultrasound images, how we will appreciate liver cirrhosis on the ultrasound images. So let's start watching these images about the liver cirrhosis. First sign of liver cirrhosis is coarse liver. On this ultrasound image, you can appreciate that liver is coarse. Normal liver parenchyma appears smooth, homogeneous and regular, but in cirrhotic patient, due to development of fibrosis and micronodularity, it appears as coarse. Fine granular parenchyma would suggest coarse liver. The next appreciable sign would be irregular margins of the liver. Look at this image, which clearly shows irregular margins. Its superior and medial border are irregular, although you can appreciate ascites around it, which is also a confirmatory sign. So if there is coarseness of the liver, and if there is irregular margins, and if there is ascites around, so these are three characteristic signs of liver cirrhosis. On this image, you can appreciate that the liver surface is nodular. Due to cell death, fibrosis and micronodularity, the liver parenchyma appear coarse and it appears nodular. This image shows micronodularity, which is a characteristic feature of liver cirrhosis. So liver will appear coarse, liver will show coarse margining, irregular margining, and also ascites around, and its parenchyma will appear nodular. These would be the sign of cirrhosis. Look at this image. A portal vein is dilated and intraluminal echogenic thrombus is seen. Always watch for portal vein and intraluminal thrombosis in cirrhotic patient. Although at earlier stage there may not be thrombus, but as the disease progresses, there is great chance of developing portal vein thrombosis. So therefore it is important to look for the portal vein diameter. If it is enlarged, mention that portal vein diameter is enlarged, and if there is any echogenic thrombus within it, so mention that portal vein is dilated and it contains intraluminal thrombosis, which is the sign of cirrhotic patient. This is another magnifying view of dilated portal vein with the intraluminal thrombosis. On the Doppler imaging, there is no blood flow seen. So without blood flow, this is in dilated portal vein with intraluminal thrombosis. On this image, you can appreciate that spleen is enlarged. Enlarged spleen or splenomegaly is another sign. Spleen would be enlarged in size. Normal spleen size is 13 centimeter, but in cirrhotic patient it will enlarge up to 22 centimeter. So therefore carefully measure the spleen in both dimension, and also look for intraluminal or intraparenchymal pathology, but they would be splenomegaly in cirrhotic patient. On this slide, you can appreciate multiple tortuously dilated veins. Splenic vein is also enlarged. Besides splenomegaly, there may be enlarged splenic vein. Normal splenic vein should be up to 1 centimeter. In progressive case, there would be splenomegaly, dilated splenic veins, and splenic varices. This is a Doppler image, and if you put the Doppler signal on, so you will find that these are all vasculature. These are splenic varices, and there is enlarged and dilated splenic vein in cirrhotic patients. On this image, you can see multiple dilated channels at porta hepatis. This happens when in cirrhotic patient portal hypertension develops. As a result, there will be multiple collaterals at porta hepatis. In portal hypertension, you will see enlarged spleen, dilated splenic vein, and multiple dilated channels at splenic hilum or splenic varices. So these are the signs of portal hypertension usually seen in cirrhotic patient. In this slide, you can see a porta hepatis collateral. Put the Doppler signals on, and you will see that these are all cystic lesions are filled with blood, and these are porta hepatis collaterals. In fully developed cirrhotic patient, you will see ascites. This you will be able to appreciate around the liver, around the spleen, and in the abdominal cavity. In this case, you can see a markedly reduced liver, or this is called as shrunken liver, which is the end stage disease. In end stage disease of cirrhosis, the liver will appear shrunken. Here you can see also ascites around the liver. So ascites develop in later stage when the case is fully developed, and there will be mild to moderate or sometime marked ascites. So you have to mention all these on your report. On this image, you can appreciate there is thickening of the gallbladder wall. This thickening of gallbladder wall is due to two reasons. The one is edema, so that is because of ascites, so edematous wall because of ascites, and second due to cirrhosis. So gallbladder wall thickening is usually seen in fully developed cirrhotic patients. While writing the report for the cirrhosis, you have to mention that liver is small in size with coarse parenchyma and irregular margins. Mention that spleen is enlarged, give its measurement. Also mention about the portal vein that is dilated, or if you have seen thrombus, mention that there is thrombus. Mention that gallbladder wall is thickened. Also mention that parasplenic and porta hepatis collaterals are dilated, moderate ascites noted, and in the conclusion simply mention that cirrhotic patient with portal vein thrombosis and portal hypertension. Some of the time, in few cases, I have seen the clinicians usually write all these findings in the conclusion as well, but whatever you feel, it's all okay, but mention in the description and in the conclusion, just be short that this is a cirrhotic patient with portal hypertension. This was all about the liver cirrhosis, and hope these images would help you to find out all the findings on the ultrasound images of the liver cirrhosis, and you will be able to write an effective report for the liver cirrhosis. Always scan the patients for the hepatoma, because most of the time there will be hepatocellular carcinoma lying within the cirrhotic patient. So be careful and scan very carefully, because this is a very important organ of the body, and when there is cirrhosis, it's mean that the patient life is at stake. So you will be very cautious, rather I would say you would be extra cautious. Keep watching my videos. My next video would be about the liver benign masses, and I will also teach about some other malignant masses of the liver as well. So see you in the next video. Till then, enjoy your life. See you then. Bye bye.